Testing. Looks like we are live and we have sound. All right. Good morning.
Morning.
How are you guys?
Good.
Not sure where everybody is. All right. Did you read chapters 5 and 6? No? Okay. And did you take the test and grade it? And do you have any questions on what you missed? All right. So I think the easiest way, so remind me of your name.
Brittany.
Brittany. All right. Brittany, how did you do?
I got 100 on both.
Thank you. And can you remind me of your name?
Mary.
Okay. And how did you do?
85 for 5 and 90 for 6.
Very good. Okay. All right. So any questions before we move on? Any questions? All right. So this is week 3. We are over half done. We only have 3 classes left after today. So things are moving along at a pretty good clip here. And it actually goes pretty fast from this point because there's not a lot of new stuff to teach you. We are going to learn a little bit more about shoe rules, but there's not a whole lot of new stuff to teach you. So we're just going to repurpose what we've learned into new skills. So from now on, it kind of goes pretty fast. Good morning. So in order to, because we're going to repurpose what we've learned, we need to make sure that we remember what we've learned so that we can kind of move on. So this morning, briefly, we're going to do a quick review of the principles just to make sure we're all on the same page because there was a whole weekend in there. Okay.
Let me ask you something.
Sure.
For the exam, we have time to review one of the things that we see in class?
Well, you have the online course that has all of the videos and the interactive activities. You're going to have practice time in here where you can practice the skills. And you have our videos on YouTube, but I won't go through each one of the skills again. You've also got the class replays that get emailed to you after class each time. So you can rewatch the entire class as well. So you got a lot of different ways to review, but I won't demonstrate all of the skills again. Okay. But all of that is still available to you. Okay. Tomorrow, I actually have my game show. I do a live game show the 1st and 3rd Tuesday of each month at 11 a.m. So tomorrow at 11 a.m., I'm going to have a game show where I'm going to do 15 questions, written test questions. And you guys can participate on YouTube. So you just go onto YouTube, watch my live stream. And when the question comes up, you select the answer 1, 2, 3, or 4, or A, B, C, and D. And the program that I use takes your answers, reads them, and awards you points if you're right. And then you go on a leaderboard and I give prizes. So it's a fun way to review for the written test. Okay. And I do that twice a month. So tomorrow will be the first one this month. And then we'll do the 3rd Tuesday as well.
And they're different 15 questions. Right?
Different 15 questions every time. I've been doing it now for about 6 months. So there's about 12 of them. 10 or 12 past ones that you can go watch on my YouTube channel. So it's, you're talking about 150 review questions there.
Okay. The clinical skills is a big deal.
Clinical is a big deal. Absolutely. Did you accept your invitation to the online program? Okay. That's going to help you tremendously, the online course. So the online course, it's not what a lot of people think I can't learn online. Okay. Do you remember the first day in here? I showed you the activity where we had to put the things in order, right? I have that for every single skill in the online program where you have to put the steps in order. I also have a supply activity where you have to choose the right supplies off of the supply shelf. So you actually click on the things that you need. And if you click on something you don't need, it tells you, no, you don't need that for this. So it's a way of making sure that you understand the steps and the supplies. But I also have interactive lessons in there about the skill itself. So that online course will help you tremendously when it comes to preparing for the state exam. Okay. But you're also going to have some practice time in here as well. So the first 2 weeks, you don't have any practice time at all because you don't have enough under your belt to practice. We didn't, we didn't know all the principles. We didn't know the opening and the closing. We didn't know how to do stuff. So having practice time really doesn't benefit you. But starting this week, we're going to have practice time at the end of every single class. So today, I'm going to have about 30 minutes of practice time at the end of class. So I quit teaching and I open it up for practice, and you guys start practicing the skills. On Wednesday, we're going to have about 45 minutes. On Monday, we're going to have about an hour. On the next Wednesday, you're going to have about an hour and a half. So we got lots of practice time built in as we progress through the program. Okay. So yeah, I've got you. It's okay. I'm going to make sure that you've got what you need. All right. So let's review this real quick. How do we know what to do with each patient? We follow the care plan, the whole care plan, and okay. While we're following that care plan, what are we observing for? Yeah, any abnormalities, changes, pain, anything we see, hear, smell, or feel. And who do we report those to? The nurse. Okay, every skill starts with the opening. Every opening starts with a knock. How do we know we have the right patient? Okay, we address them by name. Very good. And we're going to greet them because, we're nice people. What do they need to know about us? Your name and title. And what are we going to describe to them? The skill. And what do we need to get from them? Consent. Once we've done all of that, what do we close? The curtain. And after we've closed the curtain, what do we do? Wash our hands. After we've washed our hands, then we can get our supplies. But we need a clean place to put those supplies. So what are we going to get? Should we get the barrier at the same time we get all the supplies? No, you should always get the barrier first, right? Why is that? What are we trying to avoid? Yeah, we don't want the supplies to touch your uniform. Why? Yeah, your uniform is not clean. Very good. Good. All right. So when we're getting supplies, we have to think about what's required for the patient, right? So there's no real way around this. You have to learn your supplies. Okay. You have to learn the supplies, and that's just memorization. But an easy one is actually privacy. I'm stuck. Actually, privacy blanket, because our privacy blanket has a very defined rule that tells us when we need it. We're going to use a privacy blanket anytime our patient is, exposed, uncovered, or undressed. Yeah, absolutely. What is that privacy blanket there to do? Why are we using it? Okay, so warmth and dignity. Yeah, keep them covered. Very good. So when we put the privacy blanket on, should we just pull the sheet off and then put the blanket on? How are we going to do it?
Put the blanket on top of them without shaking it.
Okay.
Pull the sheet down.
Okay. Why do we have to do it that way?
So that way we don't expose anything.
So they're never uncovered. Good job. Look at you guys. And then if we use a privacy blanket, this is the hard part about the blanket. You don't want to take it off until after you've removed your gloves. Because remember, you don't want to touch that sheet with your dirty gloves. It's going to go right up next to their face. And that's the hard step of privacy blanket, because you're going to want to take it off. Good morning. Good morning. Okay, and then if we're going to use linens, we have some rules that go with linens. What can't linens touch?
The floor.
Okay, they can't touch the floor. What else can't they touch? We already went over this one. Your uniform. That's right. So no linens touch the floor. Not clean, not dirty. No linens touch the floor, right? When should we go get our linens? Should we do it before we start the skill? I mean, before we go in and talk to our patient, should we go in with our linens? No, why? Why? Why can't we just go in and get what we're going to need and then do our opening?
Because you need to ask for permission first.
Okay, very good. Oh, that's a very, very good point. Because if you go in with a handful of linens and you ask your patient, hey, can I? It really kind of takes their decision out of it. You're basically telling them, I really don't care what you think. I'm here with linens. We're going to do this. Right. And that's not really the impression that we want to leave with our patients. So it's really important that we do this in the right order. We also need to make sure that we're touching our linens after we've washed our hands as well to keep those linens clean. We've already talked about this too. We don't want to shake or snap the linens. And when we're putting linens on the bed, especially if we're changing from dirty to clean, there's a special way that we do this. Clean rolls and dirty rolls away. Very good. And what do we do if we take too many?
You have to discard it.
Okay, we've got to discard them. Very good. So where does the patient need to remain? In the middle of the bed. And what won't we have in all settings? Side rails, yeah. And we don't need them to keep our patient safe. We just need the patient in the middle of the bed. But are we ever going to turn the patient toward us or away from us? Which way? Away. We remain behind, the patient's behind, right? Okay, so anytime we're turning a patient, we always scoot them toward us and then roll them away. All bathing is done the same way with washing rules. What cannot go in the basin? Soap, right. Why? Why can't we put soap in the basin? Anybody know?
The water was clean for rinse.
That's right. We need clean water for rinsing. Very good. Very good. So if we put soap in the basin, then we can't rinse because we have no rinsing water. So whatever we wash, we rinse. Whatever we rinse, we dry. Who has to check the water? The patient. So we're going to check it. What should the water temperature be for us? Warm. And then we're going to ask them to check it. And for the test, the evaluator will probably check the water just to make sure. So make sure you're using warm water. We're going to get to Leaves method in a minute. When we're washing, we want to be careful not to get our surface wet. So make sure you're protecting the surface. If we're working on a table, that's going to be a chucks. If we're working on the floor for foot care, it's a chucks. If we're working on the bed, you can use a chucks or you can use a towel, whichever. And then if we're going to put lotion on, what do we do before we put lotion on? What do we do after we put lotion on? Yeah. And then all basins are cleaned the same way. We simply rinse, dry, and store for the test. But if our patient needs disinfected, if our care plan or our policy and procedure tells us to disinfect our basin, this process allows for that. So when we set that basin down in the sink, that's when we would spray it. Then a paper towel to pick it up, paper towel to dry the inside, paper towel to dry the outside, and one more to put it away. And then we have the closing. So we have to end the skill with clean hands. That is a testing principle. So that means we got a whole lot to do before we wash our hands. So washing hands is way, 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 way down here on the closing. So what are some things we have to do before we wash our hands? There's lots of C's here. Okay, so we need to say that word, comfortable. Are you comfortable? And we're not just focusing on physical comfort, although that's important. We also want to address emotional comfort. So how do we do that? Yeah, offer them something, magazine, TV, something. We got to address their emotional comfort. What kind of environment do they need to be in? Clean environment, yeah. And they need to be safe. So we want to look around and make sure that they're in the middle of the bed's in low position, so clean and safe. What do we need to give them before we leave? Call light. And then what do we need to open? The curtain. Okay. So all of those things have to be addressed before we go clean our hands. Now, if we have to document, when should we do that? Should we do it before we wash our hands? What do you guys think? Okay, so we're going to do all of our closing. We're going to wash our hands, then we're going to document, and then we're going to wash again. So you guys were correct, but I needed to clarify that. Okay, so we want to wash our hands before documenting and after. Good? Questions?
It says that we have to do that, like the pulse for both evaluators. Do we have to wash our hands?
So good question. Okay, when it comes to pulse is one of those skills that is going to be done a little different for the test than it is in real life. Okay, it's one of the few. The reason is in real life, you're not counting with other people. You're just going to count it once and you're going to wash your hands, document, wash your hands again. So in the wild, we're only doing it once. But because we have two evaluators, we're going to have to count twice for the test. And they understand that that's not how we're doing it in real life. So they're going to let you write the first number down.
Okay.
And then you're just going to count with the second evaluator and pick up from there. Okay. Does that make sense? Because it's not how we do it in the wild. If you want to do your closing, wash your hands, document, wash your hands again, and then count with the second one, you can. That's okay. But they are going to let you take that shortcut. Okay. Just write it down. Because they don't expect you to remember one number while you're counting another. That's pretty advanced. Okay, good. Questions? Anybody have any questions on what we've gone over? Do we wear gloves for everything?
No.
Why? Why can't we just, I mean, that would be so much easier. Just walk in and put on a pair of gloves. Why didn't you want to do that?
Because you're not gonna know what you're touching.
Yeah, you don't pay attention to what you touch. And who does that put at risk? Yeah. So remember, this is a pathogen-rich environment, and our patient is already fighting off something. So we don't want to give them another pathogen to work with. Okay. Good. So we want to make sure we know when to wear gloves. So if I'm going to touch any body fluids, any personal skin, or any non-intact skin, I need to have some gloves on. But what's the first thing my gloves should touch if I'm wearing them? The patient, not the supplies, not the curtain, not the bed controls. We want to make sure we're saving those clean gloves for the patient. All right, good. All right, let's review the skills that we've learned so far. Ready? These are the skills. So we learned mouth care. That was the very first skill we learned a long, long time ago. 2 whole weeks ago. I mean, that's a long time ago. So when we're brushing teeth, here are our important checkpoints. Of course, all of our principles apply, but here's the important checkpoints we want to remember. The patient must be fully upright. Yeah, that's a choking hazard. We're going to protect the clothing, right? What do we want to do to the toothbrush before we put toothpaste on it? Wet the toothbrush. What are we there to do? Brush, yeah. So what do we want to brush? Everything. So all surfaces. So the front, the back, the top, the bottom, and the tip of the tongue as well. We're going to allow the patient to, what do we want to do after we brush our teeth? Rinse and spit as often as they need to. And then we want to leave the patient's face and clothing dry. Good? Make sense? Okay. Dressing a resident. What do we need to ask them? Okay, we're going to ask permission. We're going to do that during the opening. What do we need to ask them about dressing? Yeah, what do they want to wear? Because they have the right to choose their own clothing. We're not going to choose that for them. When do we want to get the clothing? Before we undress them or after? Why?
Because they're going to be exposed while you wrap the clothing.
That's right. We want to limit the exposure as much as possible. How do we lift? Do we lift from above? We lift from below. Very good. Very good. And what should we do to the joints as we lift? Support them. Don't let them be all floppy. All right. USA first means undress, strong arm first. And that's important. That is the main thing that they're grading us on here. Undress, strong arm first. So when you're reading that care plan, what should we pay attention to? Yeah, which arm is injured or weak. Absolutely. Because we have to know that in order to know how to undress the patient, because we're going to undress the strong arm first. And then we'll dress that weak arm first. That way the garment just slides right on, no motion required. We don't want to overextend or force movement. Did I show you her foot? So she was a testing mannequin. Let me show you this. You're going to think I'm nuts. She was a testing mannequin. All right, hold on. All right, well, that's not working. Okay. Come on, guys. Let's go for a ride. Go over here. Okay. So this is our mannequin. And she was a testing mannequin before she retired. And the reason she retired, okay, see how this foot is like a normal foot, right? It stays upright. See that? Stays upright. It's how your foot is. It's how my foot is. It's how your patient's feet should be. And this foot doesn't quite do that. Now, what's running through here is a steel cable. It takes a lot of force to break a steel cable. And yet, somebody during testing broke the mannequin's foot. That is a steel cable, guys. If you used enough force to break a steel cable, what do you think it would do to a real person? So when we go over these things, when we say don't force movement, that's what we're referring to. Because if you break the mannequin, you would have broken a real person. And that actually did happen during testing. Do you want that person working on your grandma? So, we have to be careful there. All right. Once we get the patient dressed, we're going to adjust their clothing. We want to make sure that it looks, how should they look? Yeah, neat, clean, appropriate, put together, right? And then what do we do with our, where do we put our soiled items? Where?
Laundry.
In the hamper, yeah. In the hamper, laundry, basket, whatever. And we are going to put the call light in which hand? If they have a weak arm, which hand should we put the call light in? The stronger arm. Okay. So pulse, right? And a lot of these look familiar to us, right? We're always going to support the arm, right? At the joints. So in this case, the elbow has to be supported on the bed or a table or a chair or something. Don't have it hanging out in midair. We've already covered that. We want to make sure joints are always supported. Pulse rates are always reported over what time frame? 1 minute. We don't always have to count for 1 minute, but they're always reported over 1 minute. How do we know how long to count for? Okay, the second hand on the clock will tell us how to measure, but the care plan tells us how long to count for. If the care plan tells us to count for 1 full minute, how long are we counting for? 1 full minute. We're not going to shortcut it. If the care plan doesn't tell us, we get the shortcut. We can do it for 15 seconds and multiply that by 4. What finger can you not use to take a pulse? Your thumb. What is a normal pulse rate? Well, you guys got to know this for the test. Normal pulse rate. 60 to 100 is normal. 60 to 100 is normal. We don't want to use the flat part of our finger. What part of our finger should we use to take a pulse? The tips. Tips are much more sensitive. And where is the radial pulse located? Where's it located? Is it located at the top by your thumb or the bottom by your pinky? Top by the thumb. Okay. And when we're counting with the evaluators, what do they need to know? If we're counting with an evaluator and they're counting too, what do they need to know? Yeah, when you start, because we want to make sure we're starting at the same time and stopping at the same time so that we get the same number, hopefully. And in Florida, we're counting with 2 evaluators. And then what do we want to do if we count something? What do we want to make sure we don't forget to do? Yeah, document, write it down. The number 1 step that is missed on this skill is that people don't count for a full minute. The number 2 step that is missed on this skill is people forget to document. Those are the 2 steps that are critical for this skill. Because if I ask you to do a skill, say I ask you, hey, can you go take a pulse on bed 2? I need a full minute reading. You're like, okay, I can do that. So you go over, you take the pulse, you do a full minute reading, and then it stays in your brain. You don't write it down. Does that help me at all? No. I needed that information for something. Either I'm trying to make sure this patient is stable enough to be discharged, or I'm trying to find out if I can give them a medication, or I want to see the effects of a medication I already gave. But there's a reason. It's not busy work. If you measure something and you don't write it down, then I don't get the information I need. And that was the whole reason I asked you to do it in the first place. Does that make sense? Good? Okay. Look at how much we've learned. So hand and nail care, we learned how to do this. This is a mini mani, guys. That's it, mini mani. We're going to soak the hand in water. We take it out to wash it. We put it back in to rinse it. We take it out to dry it. When it's out of the basin, what should it be resting on? A towel. Absolutely. We're going to file the edges, but how do we file? One direction. Very good. And we're going to clean under the nails with an orange stick. Which end do we use? The slanted or the pointy end? Slanted end. And if we clean under a nail, should we put that dirt under the next nail? What do you want to do? Wipe it off on the towel before we move to the next nail. And then we're going to apply lotion. What do we do before we put lotion on? What do we do after we put lotion on? There you go. Hand and nail care. Okay, we also learned make an occupied bed. Clean rolls toward you, dirty rolls away. So you just want to change the bed a half at a time. So you're going to take the dirty sheet, roll it toward the patient, put the clean sheet on the bed. What do we want to minimize? Try to make sure there aren't very many of wrinkles. Very good. So we're going to take the clean sheet, roll it toward us, stuff it underneath that dirty sheet, and then roll the patient over, go around to the other side of the bed, do it all again. And that's how we change a sheet with somebody still on the bed. Then we just put the top sheet on, change the pillowcase. Life is good. Should we have our patient totally uncovered during that whole activity? No. What are we going to cover them with? Privacy blanket. Very good. Very good. Respirations we haven't done yet. We still have to get to. Side lying position. This was when we turned a patient onto their side, but we prepared them first. So furthest arm goes up, closest arm goes over, closest knee is bent, furthest knee is angled. If you do that, they roll super easy right onto their side. But if I don't scoot them toward me, when I roll them onto their side, where are they going to be? Yeah, on the side of the bed. Is that safe? So what do I need to do before I go up, over, bent, and angled? Scoot toward me. Very good. I want to put some pillows there to keep them in place. The pillow behind the back is the hard one. That's the roll. And then I'm going to put one between their legs, between knees and ankles, one under the upper arm, and adjust the one under their head. Which hand, I don't know if you guys remember this, which hand should the call light be placed in? Remember, we don't want that cord over their neck. So which hand should their call light be placed in?
The one under the pillow?
Yeah, the bottom hand. Very good. Very good. Okay, foot care, just like hand and nail care, a little lower and nothing with the nails. So we're going to put the foot in the basin to soak, take it out to wash, put it back into rinse, take it out to dry. But every time, good morning, every time it's out of the basin, what should it be resting on? Yeah, sounds a whole lot like hand and nail care, doesn't it? Except we're not doing nails. We're not cleaning them. We're not filing them. We're not grinding them. We're not trimming them. We're not doing anything with nails. Except there is one thing we have to do. Anybody know what that is? Okay, we're going to wear gloves. But if we're not cleaning or trimming or filing nails, but what should we be doing? Looking. Very good. Very good. And if we notice anything unusual, who do we tell? The nurse. Very good. Very good. Assisting with bedpan. It's all about the bed. Why is that an important step? Why is the head of the bed so important with bedpan? Yeah, they can't pee laying down. Can't pee uphill. So we want to make sure that we get the bedpan under the patient. We put the head of the bed up and give them what they need to go.
So during the exam, don't we have to tell the inspector that we didn't find any of it?
Yeah, you want to say something out loud like, I'm looking at the foot. I don't see any red areas or anything like that. Okay. Just some small statement so they know that you know why you're there.
So what
Good
happens
point.
if we do see something on the student's foot?
Yeah, just say, I'm noticing a red area here. I'll report that to the nurse. Oh, by the way, something kind of important. Because right now we're kind of focusing on the test, but I want to talk to you about the wild for a minute. When you're out there working, let's say that you're doing foot care. You get their shoe and sock off, you get their foot in the basin, you get your gloves on, you start doing foot care. You lift the foot up and you see the bottom of the foot is red. Okay, red. And you're like, oh, that doesn't look right. Don't put their shoe and sock or sock and shoe back on and then go get the nurse. Because if you come to me and say, hey, I was doing Henry's foot care a while ago and I noticed a red area on the bottom of his foot. How am I going to look at it? It's covered with a shoe and a sock, and I don't have the time to take off that shoe and sock to look. So you know what I'm going to make you do? Take off that shoe and sock so I can take a look. And that just doubles your work. So it's better, way better, if you notice something to say, hold on a second, I'll be right back. Go get the nurse and say, hey, I see a red area on the bottom of Henry's foot. It's uncovered if you want to come take a quick peek before I finish up. And she'll go, oh, yeah, that's awesome. Thanks. And she'll go run down the hall, take a look, and then figure out what she needs to do from there. Okay, good. Questions? All right, so when it comes to bedpan, we're going to put a chucks on the bed because all of that up and down of the head of the bed could cause whatever's in there to slosh. So you want a chucks on the bed, bedpan on the chucks, head of the bed up. Our patient can wipe themselves. Yay. So we're going to make sure they have toilet paper and a call light before we leave. Now for the test, we're just walking on the other side of the curtain and waiting. So we don't have to wash our hands because we're not leaving the patient's room. When they say they're done or hit the call light, then we'll come back in to the curtain area, put the head of the bed back down, and then put our gloves on. And we're going to take the whole bedpan and chucks out together because we need to wrap that chucks over the bedpan. Nobody needs to see what's in there. And then we're going to go dump it the way we dump everything else. Since it's pretend urine, where would that go? In the toilet. So we're going to dump our pretend urine in the toilet, rinse the basin, the bedpan, and we'll dump the rinse water in the toilet as well. Okay, good. So look at how much you've learned. A lot of stuff. A lot of stuff. So everybody comfortable with what we've learned so far? There are a few more skills that I didn't put, that you've learned that I didn't put, like range of motion. But the ones that I highlighted are the ones that students seem to have the most trouble with. All right, so let's move on to today's lessons, and we're going to learn another range of motion. So if you remember, when we did range of motion shoulder, there were 3 exercises that we can do as CNAs. So Patricia says, good afternoon from Nigeria. Great to be here. Well, welcome. Thank you for joining. We appreciate you. So there were 3 exercises that we are able to do as CNAs. There's flexion extension. Anybody know what that looks like? Flexion extension. What kind of a motion that is? If you had to describe it. Okay, so up, down. Very good. Up, down. In front. So flexion extension is in front. Okay. Abduction, adduction was side to side. And rotation was around. Okay. So the way to remember that, guys, is USA. Flexion, extension, up, down, U. Abduction, adduction, side to side, S. Rotation is around, A. Okay, so USA. All right. Some people do well with memory tricks, others don't. So if it doesn't work for you, just skip over it. But if it does, it may help. All right, so we're going to learn another range of motion today. And this is going to be on page 78 of your skills book. And these are the principles involved. We're going to follow the care plan. We're going to do the opening. We're going to evaluate if we need gloves. We'll do the steps involved with range of motion, and we'll do the closing. You guys already know how to do this. You just don't know that you know. So let me help you with that, okay? So if we look at the bottom of the page there, you can see that this skill should take somebody with your level of experience 4 minutes or less. This is going to be done on a live testing student, so you may be the patient for this. The patient will be laying in bed and documentation is not required. Now, when you see this, remember I have a video for this, so you can watch the video. So to review, flexion extension is up, down. Abduction, adduction is side to side. And rotation is around. CNAs do exercises to retain function, not regain function. So if your patient gets to here and says, ow, the next one will go below the ow. And then we'll let the nurse know, hey, this was ow, and let them figure out what to do with that. We don't solve problems. We just report them. Okay, good. So let's figure out what we're going to do with this particular patient. We want to remember to lift from below, return to start, support at 2 joints, and monitor for pain. And our care plan at the top, page 79, tells us to provide the following range of motion exercise to the resident's right elbow and right wrist. Flexion extension. So this is one exercise that we're going to do to the elbow and the wrist. Tells us to provide 3 repetitions. So this is flexion extension of the elbow. That's it. So we're going to make a muscle. Guys, an elbow is a hinge joint. It only moves in one way. If you get an elbow to do anything else, you broke it. This is all it will do. The wrist, however, our care plan tells us to do range of motion, flexion extension, which is make sure you're working on the correct extremity. That's the skill. Super easy. If I had to get a skill for the state exam, this is the one I would want. Super easy. So let me get a volunteer, somebody to come lay down in this bed for me. And I'll show you what this looks like. All right, here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I'm just going to take this out from behind your head. That doesn't look very comfortable. I need to do some range of motion on your right elbow and wrist. Is that okay? I'm going to close your curtain, go wash my hands, and I'll be right back. Now, I'm going to simulate hand washing for the sake of time because the evaluator told me that I can. So my hands are clean. I've just washed them. So I'm going to do all the work here. All you have to do is let me know if there's any pain or discomfort as we do this, okay? First thing I'm going to do is bring your arm up like you're making a muscle and then back down to the bed, and I'll do the work. So we're going to turn your hand palm up, and we're going to go up and all the way back to start. Feel okay? Any pain? Up, all the way back to start. Feel all right? One more. Up and all the way back to start. Good job. Now we're going to move on to the wrist. We're going to go up and down like you're revving a motorcycle. Let me know if there's any pain. So loose fist, forward and back. Feel a little stretch. Forward and back. Still okay? Forward and back. Good? All right. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Call light's right there. Hit the red button if you need anything, and I'll be right in. I'm going to open the curtain. Wash my hands. I probably would review that care plan one more time just to make sure I did everything right, and then tell the evaluator my skill is done. Thank you.
And if you didn't do everything right,
Make a correction.
marked off, you make the correction and you're good.
Make a correction. So let's say I did that whole skill, and I realized at the end that I did it on the left side. What does my care plan tell me to do?
The right side.
The right side. But I did it on the left. So I could say correction. I would have made sure I was on the correct side of the patient. I would have done this on the right, according to the care plan. Okay. They're not going to make you re-demonstrate the entire skill because they've seen it. Now, if you said, oh no, I did abduction, adduction, not flexion, extension. I did the wrong exercise. Well, that they need to see because they don't know that you know how to do flexion, extension. Does that make sense? So they'll tell you when you make a correction whether they need to see it or not. Good? Questions? That is a super easy skill. I would want that skill. Unlike the next one. The next one is denture care. This is going to start on page 96. And we've got lots of principles, but you know all of them. So nothing new here. Nothing exciting. Not a lot to learn, but this seems to be one of the hardest skills for students on the state exam. We've got a mess here. Dentures aren't hard. They really aren't. But students seem to struggle with this because there's two parts to this skill. We're going to clean the dentures and we're going to clean the mouth the dentures came out of. So it's a big skill. In fact, if you look down here at the bottom of the page, you'll see that somebody with your level of experience should be able to get this done in 13 minutes or less. That's a big skill compared to 4 minutes of what we just saw. So I know that it's a bit intimidating. Further intimidating because most of you guys have never really worked with dentures and you find them a little bit creepy. Okay. So the first thing that you need to know is that we don't touch dentures without gloves. You can touch the cup, but you don't want to touch the dentures without gloves. Now, something about dentures that a lot of people don't know is that CNAs do not take dentures out. CNAs do not put dentures in. If the patient can't do that themselves, they don't wear their dentures and we puree their food. The reason for that is that if I have dentures in, particularly lower dentures, they're probably held in with denture paste. Okay, it's sticky, gummy. If I've got dentures held in with denture paste and I want to remove them, I've got to take my fingers and go way back here at the very back edge of the denture and pop it up and forward to get that suction to release. Now I can do that on myself. The leverage is right. But if I put my fingers in somebody else's mouth to pop those dentures up, these knuckles right here have to press down in order for my fingertips to press up. I have to have leverage. Well, these knuckles pressing down can dislocate the jaw pretty easily, actually. So we don't, because we aren't aware of how much force we're exerting on that lower jaw. And because we're exerting that force at the hinge, we can dislocate the jaw. So that's never a good day for our patient. So we don't take dentures out. Now, putting them in, way worse for you. Because when you put dentures in, patients will instinctively bite down to seat those dentures. If you've got your hands in somebody's mouth putting dentures in, when they instinctively bite down, what are they going to bite? You. So that's a bad day for you. So both of these are a bad day for somebody, so we're not going to do it. Good? Patients have to be able to take their own dentures out and put their own dentures in to continue wearing them. But we can clean them. Now, there's a couple of different ways that we can clean dentures. And there's a couple of different types of dentures that we need to be aware of. So let's go through this real quick. Let's look at the care plan before we get into the instruction. So the care plan at the top, page 97, tells us a resident with dentures is sitting at an overbed table with their dentures in a denture cup. So they've already taken them out. They put them in the cup. The resident's denture needs to be brushed with toothpaste, and the resident needs mouth care. The denture is stored in a denture cup after cleaning. The resident is not able to provide their own mouth or denture care. Good? Questions? All right, if you look down here at the bottom of the page, these are all of the supplies that you're going to need to perform this skill. There's a lot of supplies. A lot of supplies. You have to memorize them. Flashcards help. Remember, we have flashcards that you can purchase that has the supplies, we have principles, and we have steps. So the flashcards will help, or make your own. But you do need to start working on the repetition part of supplies. Okay, good. Questions? All right, so we are going to clean both dentures and the mouth. But when it comes to dentures, they're not all equal. They don't all look the same. Now, when we think of dentures, most of us think of this. This is a full plate. This is an upper plate. That is a full plate of dentures. This is what we think of when we think of dentures, right? Kind of looks like that thing at the top. It's a full plate of dentures. This means that we've taken all of the patient's natural teeth out and replaced all of them. But if our patient still has some good teeth, we don't want to pull teeth that are still in good condition. So we don't always take all of their teeth. Sometimes we just take the ones that need to be removed and leave the rest. And that creates a denture with holes or cutouts that are going to fit around the patient's remaining teeth. This is called a partial. Okay, so full plate, partial, and then sometimes we just do little tiny pieces of dentures. We're only filling in a couple of teeth, and that is a bridge. Now, a lot of bridges are now implanted. So we don't see bridges very often, removable bridges very often, because a lot of them are now implanted. But you may see it from time to time, little pieces of dentures. Now, they're all cleaned the same way. But I find it's helpful if you kind of understand the different types of dentures that we have. So good? Questions? Jake's got it. All right. So we have different types of dentures, and they're all going to be cleaned the same way. But we don't just have to clean the dentures. We also have to clean the mouth the dentures came out of. And to do that, we're actually going to need 2 sets of gloves for this skill, which gets a little confusing for students because this is the first time that we've really had to focus on this. So the first thing we're going to do is clean the dentures. So we put our gloves on, we're at the sink, we clean the dentures, take care of all that. Now, once we clean the dentures, are our gloves clean or dirty? Dirty. Do you think that patient wants those dirty gloves in their mouth? No, so we want to make sure that we're changing those gloves so when we clean the patient's mouth, we have clean gloves to do so. Make sense? So this skill will have a glove change, and that kind of trips students up quite a bit. When we're working with dentures, there's 2 ways to clean them. Our care plan is going to tell us exactly how to clean these dentures. We read it. It told us to clean the dentures with toothpaste. That's one way to clean. But the problem with toothpaste is that it's abrasive. Now, on your teeth, that's fine because your teeth are living and the body can regenerate because abrasive toothpaste is going to cause little micro cracks to form. Dentures, however, are not living. They're plastic, really, a polymer resin. So because toothpaste is abrasive, when we brush dentures with toothpaste, it actually causes little cracks to form. And bacteria find those cracks as warm, dark, moist places to hang out and have a family. So that's a bad thing. Your patient will determine which method they want used. Okay? Most people that make dentures will tell you that denture tablets, putting them in a cup with water and the fizzy tablets, is the best option. But sometimes our patients want their dentures cleaned with toothpaste. So how do we know which method to use? The care plan. Because as the nurse, when I go in and I do the assessment and I'm head to toe looking for real problems and potential problems, this is definitely going to be on the list. I'm going to find out, do they have natural teeth or do they have dentures? How are they caring for their dentures? Do we need to help with denture care? And if so, what is the preferred method? And then I'm going to write that on the care plan. Good? A denture tablet, super easy. The patient takes their dentures out, puts it in a cup of water. We make sure the water is clean. And then we put 2 little fizzy tablets in, put a lid on it, and let it soak for a couple hours or overnight. We rinse them off the next day, maybe a soft brush to get any particles off, and good to go. Brushing them with toothpaste, we're going to brush them just like their teeth. So top, bottom, front, back, all of that. Good? But when we take these dentures over to the sink and we've got them covered with toothpaste, they're probably going to be a little slippery. Remember, we have gloves on for that. So we don't have good grip with gloves. So we've got slippery dentures and non-grippy gloves, which means the dentures might fall. If dentures fall into the sink, they're likely to break. So we're going to put a washcloth in the bottom of the sink to create a softer surface. That way, if the dentures do fall, they're less likely to break. Now, if you can get that washcloth over the drain, that's even better because that's going to let water pool up in the sink, and that will help if the dentures fall, then they're hitting water, not anything hard. Good?
They will break. They will.
They
both
will
they're not
break.
gonna break if we drop them. They trust me. You will be. That's expensive.
Yeah.
Sorry.
No, you're absolutely right. They will break.
Oh,
And dentures are running between $5,000 and $6,000.
you will not feel so bad. You will feel terrible.
Yeah.
Sorry again.
No, you're absolutely correct. 100% correct. And that's why putting a washcloth in the bottom of the sink is one of the biggest checkpoints for this skill.
I have a question.
Sure.
Does it matter which one we do first, as in like doing the denture? Or the
Okay, so the answer to that is no, it doesn't matter. You can brush the mouth first. You can brush the dentures first. Nobody cares. But it's all about time management. Okay. So let's say, just for giggles, right, you have 10 patients to work with. You're there 12 hours taking care of 10 patients. Okay. Following me? Now, you spend 10 seconds extra with this one, 15 seconds extra with this one, 2 minutes extra with this one, 1 minute extra with this one. And over 10 patients, that's going to add up, right? Well, this is how we end up not having time for our break because it only takes 3 extra minutes with each one of those patients over a 12-hour shift. I mean, you're talking about micro fractions of time, right? And you won't have time for your break. So time management or economy of movement actually plays a huge part in your ability to get everything done. So this is why it's better to do the dentures first and then the mouth. So let me explain. It's all about time management. You can do it the other way, but it's all about time management because in order to take this denture brush over to the sink, I can't lay it on the side of the sink. The side of the sink is not clean, right? I don't want to lay this brush that I'm going to use to brush our teeth on an unclean surface. So I have to have somewhere to put this when I take it over to the sink. So I'm going to use a basin. This is the same basin that we used for mouth care, right? So when I'm over at my table getting everything ready, I'm going to dump this in water because we always wet the toothbrush before we put toothpaste on it. I'll put toothpaste on both sides and I'm going to set it in my basin just to hold it. So this basin's going to go over there and just hold the toothbrush. That's it. That's all it's doing. When I'm all done with denture care and I'm ready to brush the teeth, now this basin will hold spit, right? Because after they've done rinsing, they're going to spit. And then I'll clean the basin before I put it back. Good? Okay. Now let's swap that for a second. Let's do the mouth first. Clean the mouth. They're going to spit in the basin. Now we have to clean the basin before we can use it to hold our brush. So we clean the basin out. We get our brush ready. We put the brush in there. We take it over there. Well, now that it's held the brush, what do we have to do again? Yeah. So because we're washing our basin twice, doesn't sound like a lot, right? But it's going to take you about 15 seconds. Those 15 seconds are going to add up over time. Does that make sense? That's why it's better for time management to do the dentures first and then the mouth. You're only having to clean the basin once. Good? Questions? All right. So this is a denture brush. Looks like a toothbrush, but it's double-sided. This works just like a toothbrush. We're going to put toothpaste on it. And it's going to brush the teeth, part of the dentures. This is smaller. It's designed to fit in the groove or the channel of the dentures, the part that fits over the gums. So we're going to wet it, put toothpaste on it. We're going to use this in the channel part of the dentures. So this is a denture brush. So once we've cleaned the dentures, we have to clean the mouth those dentures came out of. We're just going to use mouth care techniques. You've already seen that done. Put a towel over their chest, wet the brush, put some toothpaste on it, brush all surfaces, top, bottom, front, back, tongue, all of that kind of stuff. But instead of using a toothbrush, because dentures are held in with gummy paste, that paste is going to get all up in the bristles and it's not going to be very effective. So instead of using a brush to clean the mouth, we're going to use this. Because remember, we're not at the sink. If we were using a brush at the sink, we could rinse the brush out a lot. But over here at a table, we don't have running water. So instead, we're going to use this. This is called a toothette or oral swab, and it's just a soft, spongy, looks like a lollipop, doesn't taste like one. But we're going to wet it just like we do everything else. We're going to put some toothpaste on it, and then we're going to use this on whatever's in the patient's mouth. If it's just gums, we'll clean the gums. If it's gums and teeth, we'll clean the gums and teeth with this. But the reason we use this is because it's four-sided, right? We have top, we have bottom, we have top, we have bottom, four-sided. So it allows us to swipe that paste away and turn it. Swipe the paste away and turn it. Swipe the paste away and turn it. So it's the solid surface will help with the paste part. And then this is disposable. We just throw it away at the end of the skill. So you guys can pass that around. It is mint flavored. It's not a particularly nice mint, but it, it is what it is.
Now for mouth care for a skill at the test.
Real person.
Yes.
Real person. And remember, they're already going to have their dentures out in a cup sitting on the side of the table.
So we actually do the dentures, but with the mouth care.
You're still going to clean the mouth. You're going to use the toothette to clean the mouth. Mm-hmm.
Okay.
Yep. Because remember, this will clean whatever the patient has. If they have gums, we'll clean gums. If they have teeth, it cleans teeth too.
I just wasn't sure if we were going to fake putting it into the mouth. We are
Nope.
putting it into the mouth.
No, we're not putting the dentures in the mouth.
No,
Remember,
sponge.
yeah, CNAs don't put dentures in or
Right,
take
right.
them out. So the dentures are going to be stored in a cup. We're going to get to that in a minute.
But the sponge.
But
is going into
the sponge goes into the mouth for real.
What do we do with the toothbrush, the denture brush?
We're just going to rinse it out and we're going to store it.
Okay.
Yeah. Rinse it out and store it. Okay. So this is what the toothette looks like. And remember, we're going to wet it and put toothpaste on it and use it just like a regular toothbrush. So at the beginning of the skill, remember that we don't have to have gloves on to touch the denture cup. Remember I talked about that, right? So at the beginning of the skill, I'm going to do my opening. Knock, knock, knock. Hi, Miss Jones. My name is Patti. I'm your CNA today. I'm here to do denture care. Is that okay? Pull curtain, wash hands. But before I go wash my hands, I'm actually going to pick that denture cup up and take it to the sink with me and just set it on the side of the sink. I'll wash my hands. I'm going to get my barrier, put it on the table, get my supplies, put that on the barrier. And then I'm going to wet my denture brush, put toothpaste on both sides, and put the denture brush in the basin. And I'm going to take that over to the sink where my dentures are already hanging out in the cup. Okay. I'll put my washcloth on the bottom of the sink, turn my water on, and it should be cold. Cool. Not hot. Now, the reason for that is that there's a principle in science. Heat coagulates proteins, which means nothing to you, I know. But think of it as it's going to make whatever's on those dentures stickier and harder to remove. But we don't want to make the skill any harder than it already is. So cool or cold water is what we're looking for here. Okay, good. Questions? So I'm going to rinse the dentures. I'm going to use my denture brush, brush the teeth part of the dentures, brush the groove of the dentures, brush the palate, everything. And I got to make sure that there's lots of bubbles on there, lots of suds, and then I'll rinse. Now, once I've rinsed those dentures, I've got to have a place to put them. That water that they were in is icky, has food particles and all kinds of gross stuff in there. I don't want to put these clean dentures back in there. So I'm going to dump that water out, rinse the cup, get cool, clean water, and then put the dentures in the clean water. Okay. And then I'll take the denture cup, put the lid on it, and carry it over to where the patient is and set it down. But this cup is going to be wet. What do you think is going to happen if I put a wet cup on a wood surface like this?
Isn't there gonna be a barrier then?
Hold on.
Oops, I'm sorry.
Yeah, I'm leading you there.
It's gonna stain it.
Yeah, it'll warp it. That's right. It'll actually eat into the wood and discolor it. Housekeeping isn't going to like us if we go around ruining their furniture. So you're absolutely right. We're going to use a coaster or a barrier underneath that wet cup. You can put it on the table or you can put it on the bedside table, just wherever the patient wants it. Okay, good?
No,
Okay.
because didn't we already put a barrier on there before? Because we still have to do the mouth care.
Right. There's a barrier on the table. You can put this on the barrier, but at the end of the skill, we're going to leave the cup with them. So when we take that barrier away, we have to have something under the cup if it's going to stay on the table, or you can just put it on the bedside table and that way you don't have to move it later. Either way is fine, but it still has to have a barrier under it.
I'm getting anal about the test. Sorry.
No, you're absolutely right. You should be. Now is the time.
So you need another barrier?
No, just a paper towel.
Okay.
Paper towel. All right, so the basin holds the denture brush because we don't want to put it on the side of the sink. And we want to make sure we put a washcloth in the bottom of the sink to protect the dentures. And then we'll use a paper towel to turn that cold water on. Why do I need a paper towel? Turn the water on.
It's a barrier.
Right, because the faucet is,
Dirty.
and your hands are clean. Okay, remember, we use cool water. We want to wear gloves when we handle the dentures. And the first thing your gloves should touch is the patient, or in this case, the thing that came out of the patient, which is the dentures. And then we'll brush all surfaces, being careful not to drop the dentures. We don't want to set those dentures down inside the sink. That sink isn't clean. So we want to keep them in our hand over the sink. And then we're going to rinse the denture cup and fill it with cool water so we can put the dentures, the clean dentures, in the denture cup to hold. And we'll put the lid back on as well. We'll set them on a paper towel on the bedside table. Okay, good. And then we're ready to do mouth care. We'll put the washcloth in the dirty linen. You can do it now. You can do it at the end. Doesn't matter. Whenever you want to do it, just make sure you don't leave it in the sink. And we'll bring the denture brush in the emesis basin back over to the overbed table because we're going to need that emesis basin for the rinse and spit portion of the skill. This is just mouth care. You guys already know how to do this. Wet the brush, put toothpaste on it, brush all surfaces, let them rinse and spit. Nothing new here. It's just mouth care. And remember, the first thing your gloves should touch is the patient. So get all of that stuff ready before you put your gloves on. Okay. Now we'll perform mouth care with a toothette and toothpaste. So yes, it is real. We want to leave the patient's mouth clean and dry at the end of the skill. And I'm going to show you this skill. I'm going to show you the video for this because it's got good close-ups of all of these different steps. This is one of the hardest skills for students on the state exam. It's a long skill. It's got a lot of steps. And it's one that most of you guys aren't real familiar with. Now, we do have dentures here that you can play with, that you can practice. So I would suggest practicing this skill in class. If you can't practice here, the practice kit that I sell has dentures in it. So you'll have dentures that you can practice at home. They're not real. They're fake dentures, but there's something that you can practice at home with. Okay. All right.
Hello,
Hi, Mr. Jones. My name is Patti. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with the paper towel to store the basin and other supplies. I'll remove the barrier from the table and we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay. Any questions on denture care? This is one you guys are going to need to practice because there's a lot of steps to it, and I make it look a little easier than you're going to find it. Okay? Good. Let's go ahead and take our break. When we come back, we're going to learn 2 additional skills you will have time to practice in class today. I don't have work to do. Okay, any questions so far? No? Are we good? All right, moving on. Page 66 in your book. And we have ambulate with a gait belt. Ambulate is a fancy word for walk. So this skill, ambulate with a gait belt, means we're walking a patient with a gait belt. That's it. Not a whole lot to it. But in order to understand how to do this skill and why certain things are important, we have to talk a little bit about energy conservation. So I'm going to get into that before I show you the skill. But let's go over the rules that are involved here. So we're going to follow the care plan. Every skill starts with the opening. Every opening starts with a knock. We're going to evaluate if we need gloves for this patient. Shoe rules we're going to get to in just a minute. We have to learn how to the skill specific steps, and we're going to end with a closing. So there's not a whole lot to learn here. This is a quick skill, 5 minutes or less. You're going to do this on a real testing student. That student will be positioned in a chair at the beginning of the skill, and charting is not required for this skill. So there's not a whole lot new here, but there are a few things that I need to bring to your attention that you're probably not aware of. So page 67 of your book, your care plan is at the top of the page, and it tells us to ambulate the resident at least 10 steps. Use a gait belt or transfer belt. Patient will be sitting in a chair at the side of the bed with shoes on. Patient is able to walk but needs assistance to stand. Now for the test, the chair is going to be right beside the bed. Here, I'm going to bring it out a little bit just so you guys can see a little bit better, okay? So this tells us to ambulate at least 10 steps. That's round trip. So 5 steps in one direction, 5 steps back. The evaluator is actually going to give you a destination. They will say, walk to the second table back there and back to the chair. They're going to, walk to a bookcase. They're going to give you a destination. And one of the reasons that they're doing that is that this is a skill that they try to trick you on. So it's important that we understand this. This is a skill they try to trick us on. So to show you what I mean by that is when you start this skill, so when you're the patient for this skill, you're going to be given a script. So you're going to be told what to do as the patient. So they're going to tell you, walk like you walk. Don't turn into a 90-year-old. Okay, walk like you walk. They're going to tell you that you can stand and walk just fine. You just need a little assistance with the standing part. Now, when they're giving that instruction to the patient, one of the evaluators is going to move a table or a chair or something in your path. And the other evaluator is going to tell you, I want you to walk to that table and back. So what they're looking for here is if you scan the environment before you stand the patient up and recognize that that is in your way. And you take the time to move that before you walk the patient. Because once you stand that patient up, you cannot leave that patient to move any obstacles. Does that make sense? Now, this is, if you watch the video, I don't have that step in the video because it's something that they added after I did the video. So you're not going to see that step. So it's important that that I tell you about that to begin with, okay? So they're going to give you a destination. They're going to put something in your way. Make sure you look around for any obstacles and move them before you start walking, before you stand the patient and start walking. Supplies for this one, super easy. You need shoes, which the patient already has on, and you need a gait belt. So a gait belt is this. This is a gait belt. It is a flat canvas belt with a metal buckle and a free end. It's a gait belt. Does not matter whether the buckle faces this way or the buckle faces this way. Nobody cares. What matters is the tag is on the inside, like every other article of clothing. So when you put this around the patient's waist, you want to make sure it goes around the natural waist. It should not be up here. It should not be way down here. It should be at the natural waist. And you want to make sure when you're putting it on that it's not twisted. See how that's twisted? We want it flat. So you put this around the patient's waist. I'm going to demonstrate on me just so you can see. This goes around the patient's waist. So you put it around their waist. You put the free end through the first guard by the alligator teeth. And you pull it the way the teeth are pointing to snug it up. We get skinnier when we stand up. Let me show you what I mean by that. If I'm sitting, okay, and I put this on, see how that's pretty snug? When I stand up, you see how it got a lot looser? This is too loose. If my patient starts to fall and I grab this to try to keep them from falling, it's going to go up underneath their breasts or underneath their arms, or they'll slide right out of it. So when you put this on, when they're sitting, you want to make sure it is snug. You only want to fit 4 fingers between the belt and the patient. And then you're going to lock it back in the second guard. If this tail is too long hanging down, you tuck it up. Go ahead. And then when you stand the patient up, it stays snug around their waist. Good. Now, once you return them to the chair, you're going to undo the gait belt. So once they're sitting, to undo the gait belt, you're going to take it out of the second guard. But now if I pull it, it's just going to tighten. That's not going to help. So what I want to do is grab the metal, and slide it along the belt to remove it. Okay. When you remove this from around their waist, do not do this. Do you hear that? That's a burn. That's because it's canvas. That will burn their skin. So we don't want to pull it against their skin. We're going to loop it up over, or when you go to remove it, you can reach your arms around and remove it that way. But don't slide it against their skin. Good? Questions? Okay. So we're going to learn some new shoe rules. Now, we've already learned 1 and 2. If the patient's feet hit the floor, we talk about their shoes. Remember we talked about that with foot care, right? Patients need to have shoes on. We also learned that slipper socks are not enough because they don't protect against pathogens. And I just told you we're going to use 4 fingers between the gait belt and the patient. So we've got a couple of other things that we're going to learn here. Now, when we're lifting a patient, we used to, a million years ago, we used to teach people, this is how I learned actually a million years ago. We used to teach people to stand in front of the patient, knee to knee and toe to toe, so their feet don't slide out. And that sounds like a really good idea. The problem is it's horrible body mechanics. So I want you to imagine me sitting in this chair. I'm going to switch places, but you've got a visual of me sitting in this chair. If I'm the caregiver and I'm standing toe to toe and knee to knee, there's a physics principle here. Every action has an equal and opposite reaction. So if I'm standing toe to toe, knee to knee, and I'm getting the back of the gait belt and I'm lifting this patient toward me, their entire body weight is coming my way and my body is going to go back with equal force, which means my lower back has to absorb all of that force. And that's going to lead to back injury later on. That's not safe. But it's also not safe because it takes me off balance, which means if I'm going backwards and I don't stabilize myself and I start doing this, then I can drag the patient with me because remember, I'm holding on to the patient. And that means it's not just one person falling, it's two. That's not safe. So let's go back here for a second. Hold on, guys. Stay with me. Okay. For those at home. All right. So if you look, if I'm sitting in the chair and I'm the patient, and you look at the floor, do you see the line that's in front of my feet? Can you guys see that line? See the line on each side of the chair? I am literally in a box. These lines form a box. And that box is what I'm going to use for body mechanics. Okay, so keep the box in mind. Hold on. I've already been over that. Where's my body? All right, well, we'll come back to that. Okay, so body mechanics. I have a line in front and the line on each side. So if I've got a patient sitting in that chair, I'm going to take one foot and go across their feet. That keeps their feet from sliding out. Right in front of their feet, across or perpendicular. This leg goes parallel to the chair. So I'm standing at the corner of the box, 1 foot on each side of the box. And then I'm going to bend at the knees, not at the back. Bend at the knees, reach around behind the patient, grab that gait belt, and on the count of 3, 1, 2, 3, we're going to stand. And when we do that, I'm much more stable, but their body weight isn't affecting my back. Okay? So we want to stand at what we call an oblique angle to help our patient stand. Okay. So their feet must be flat on the floor before standing. Let me show you this. I am short. I have short legs specifically. So when I'm sitting in a chair like this, you guys can see on the camera, my heels are not on the floor. If I'm sitting all the way back, I can't put my feet flat on the floor because my legs just simply aren't long enough. I prayed for legs when I was a kid. I got hips instead. I should have been more specific. Length, not width. All right. So in order to get my feet flat on the floor, what do I need to do? Scoot forward. Now, if I'm just sitting in the chair and you don't pay attention to that, and you try to lift me up and I'm on my tiptoes, what's going to happen? What's going to happen? If you try to lift me and I'm on my tiptoes. Yeah, it's going to make me very unsteady. And I'm going to most likely fall, or at the very least, my equilibrium is going to be off. That puts both you and your patient at risk. So you've got to take the time to look to see, are their feet flat on the floor? And it's even better if you ask them, are your feet flat on the floor? Can you scoot forward so your feet are flat on the floor? You want to make sure that before you lift them, they're on stable footing so that when you lift them, they can just stand and support their weight. Okay? So that's an important step. We have to make sure their feet are flat on the floor. Before we lift anybody, we're always going to count. On the count of 3, we're going to stand. 1, 2, 3. If I just come along and grab somebody and try to lift them and they're not prepared for it, first of all, they're probably going to fight me a little bit. You know, they're going to be resistant. But the real problem here is that now I'm doing something to them, not with them. And that's a totally different mindset for your patients. So we want to make them a partner. On the count of 3, we're going to stand. 1, 2, 3. And then you lift. Make sure you're counting. For the test, that is a checkpoint. Once we get them standing, we probably want to ask, is everything okay? You don't want to, move the camera again. You don't want to just stand them up and start moving, because when you do that, if they're dizzy, you don't have a whole lot of accommodation time. So, and that does happen. I mean, remember, our patients are in a place where they're undergoing medications, treatments. They have processes going on. So they may be dizzy or weak. They're not getting adequate exercise, so their muscles may not be acclimated. We got a lot of issues going on, right? So if I just stand a patient up, right, and then I start walking them and they didn't have time to acclimate, we may end up in trouble down the road. What's even worse is if I stand them up and they're dizzy. We're not going to make it too far down the road. And this is where a lot of CNAs go off track. If we're walking somewhere, okay, if I'm the CNA and my patient is the patient and we're walking somewhere and we get way over here and the patient says, yeah, I'm not feeling right. I'm dizzy, nauseous, whatever the case may be. I don't have a lot of options. I'm way over here. So what most CNAs will do is panic and they will try to get the patient back to the chair as quickly as possible. Safety, right? So you're thinking with a brain that's attached to a body that's fully functional. Our patient does not have a body that's fully functional. If they're not tolerating a slow walk, you think they're going to be able to tolerate a rush back to the chair? You get them turned around, and that's going to be it. They're going down. And this happens a lot. Unfortunately, I've seen a lot of patients fall in my career, and it's universal. I'll ask the CNA what happened, and the CNA will go, I don't know. We were just walking, and next thing I know, they're on the floor. Well, that tells me you weren't paying attention, because patients don't just walk along. I'm fine. I'm good. Everything's great. Ugh. Right? It doesn't happen like that. Patients always give you signs. They slow down. They get pale or sweaty. They'll put their hand out to the wall, or they might even put their hand on their head or their stomach. They'll get shaky. They'll start to sway. They give you a million signs that something is going very wrong. But if you're not paying attention, it's going to seem like we were just walking and then they were on the floor. So your focus when you're walking a patient should be 100% on the patient, not your phone, not the TV, not another coworker, your patient.
So what if you stand them up and they say like everything's good, and then you get to walking and then they do get dizzy? Like what would you do in that situation?
Okay, so we can't rush back to the chair. They're not going to make it. We know they're not going to make it. So the best thing to do is to help them sit on the floor, because a patient that's sitting on the floor can't fall on the floor, and falls are where injuries happen. So we can turn them around and back them up to the wall and help them slide down. But for me, in most cases, the easiest thing for me to do is if I'm walking a patient, now I should always be slightly behind into one side. So my patient is always right here, always. I have the gait belt and an underhand grip, so I'm starting to feel that wobble. So we're walking, he's getting wobbly, puts a hand out against the wall. I know things are not going well. We're not going to make it much further. I am going to, as we're walking, I take this leg, because it's my stronger leg, and I stomp forward right in between their legs. Okay. So I am now in this position. I'm going to take my other hand, hold the gait belt, and I'm going to pull the patient back so they're resting against me, and then slide them right down to the floor. Okay. And then I'm going to go find a nurse. Do I solve problems? No. I now have a safe patient who is on the floor, safe. They can't fall. Ideally, I don't want to go find the nurse. Ideally, I want to send somebody else to find the nurse and stay with my patient. But if I needed to, the patient is safe. Okay. So the way that we do that is when we're walking, they get a little squirrely, stomp. I want a nice wide base of support, and I need stability. Second hand holds the gait belt, pull them back against me. You doing okay? We're going to slide to the floor. Ready? 1, 2, 3. And I'm just going to slide them right down me to the floor. Okay, you can prevent a million injuries using that technique. but you got to pay attention to your patients. And that's the biggest thing about this skill. When you're walking, don't assume your patient is able to do what you do. Okay, things can go south very quickly. If you're paying attention, you'll be less likely to have your patient fall. You can intervene instead. All right, but I'd rather, in an ideal world, I would rather find out here. So when I stand the patient up, I'm going to ask, are you dizzy? Are you weak? Everything good? Nauseous? We good to go? If they say, yes, I don't feel well, oh, we're sitting right back down. We're not going anywhere. I only walk patients that can walk because I know I'm going to get 15 feet down that hallway and it's all going to go south. So we stand the patient up. Are you dizzy? Yes. Okay, let's sit back down. Do I solve problems? Who does? Good. Make sense? Now, when we do sit a patient back in the chair, they need to know that that chair is behind them because they're not the ones sitting. We're helping them sit. If they can't feel that chair behind them, they're going to panic. You do this without thinking. When you go to sit in a chair, part of your body always touches that chair before you sit. You don't realize you do that. Pay attention. You will now. So we got to back that patient up until they feel that chair. And I'm going to ask them, let me know when you feel the chair.
Or the toilet.
Yeah, toilet, anything that we're sitting them on, the bed, anything. Most patients have been dropped. That's scary. Can you imagine? You would have trust issues. I would have trust issues. Well, I have trust issues and I've never been dropped, okay? So if you try to sit me down in this chair and I don't feel that chair behind me, I'm not entirely sure that you know what you're doing. So we're going to ask them, can you tell me when you feel the chair behind you? Or can you feel the chair? And then once they say yes, then we can help them sit. Good? All right, let's talk about energy. Well, let's get through this and then we'll get to energy conservation. All right, so we're going to stand at an oblique angle when we stand them up. That's what I showed you. And we're going to put the gait belt on over the patient's clothing at their natural waist. We're going to hold the gait belt around the back and sides to lift. Now this, lately, I got to stress this because lately in my classes, I've seen quite a few people that are getting this wrong. So I want to take a minute just to go over this again. When your patient has a gait belt on, and we've checked it, 4 fingers, lock it through the second guard, tuck our loop up. When we go to lift our patient, you don't want to lift from the front. Most of my body weight is on my back. Okay, so if I'm sitting, most of my body weight is back here. This is where you're going to lift from. So if you're lifting from the front and pulling, you're not pulling where the body weight is. That's going to take more force on your part, result in injuries to the patient, but it's not going to be comfortable either. Your hands need to be at least on the sides if they're a bigger person, or more toward the back if they're a smaller person. So you're lifting where the body weight is. Okay, so super important that we make sure we get our hand placement right. Never in the front. Okay?
I have a question.
Yes.
So what happens if we get a patient who can't use the gait belt because they like bruise easily because of the force?
Okay. So where would we go for information on that particular patient? The care plan. It's up to the nurse to figure out the appropriate method that we're going to use for that patient. But it should never be grabbing them by their arms. Remember that most of our weight is here, right? When we go to stand up, along the back side, the hips, that's the legs, that's where most of our weight is. If you're holding here at the arms to lift them, you're lifting the top part of their body, not where the weight is, which again is going to require more force. So that means your fingers are going to dig in to lift the patient. So if I've got a patient on blood thinners, that is absolutely the wrong method to lift that patient. Make sense? Some people understand, okay, well, I can't pull at the arms because that's not really where their weight is. I need to do at the center. So let me grab their pants and lift with their pants. Have you guys ever had a wedgie? Because that's what we're doing. We're giving them a monster red, and they will move. They'll move quick, but they're moving because you're hurting them, not because you're helping them. So we never lift with the arms. We never lift with their clothing. Gait belt is the ideal way of lifting. If we can't use a gait belt, then I'm going to have to come up with a different method of lifting the patient. Usually it's going to be a mechanical sling lift or a sit to stand Sarah lift or something like that. Okay, good. Makes sense? Okay. So if you look at this picture, when you are lifting a patient up to stand, do you see how she's positioned? So this is our caregiver. This is the gait belt. She's holding at the sides. But do you see how this patient is kind of leaned backwards? This is unstable. No good. We want our patient to move as a unit. So in order to get our patient to move as a unit, their arms need to be resting on our shoulders, not behind our head, not on our neck, just resting on our shoulders. When we do that, they move as a unit and you don't get this trailing behind effect. Okay, so you want to make sure that their hands are on their shoulders. So we want to say, hey, I need you to put your hands on my shoulders, and on the count of 3, we're going to stand. Remember that we remove any obstacles before we stand our patient to walk. And we're going to put the gait belt on and make sure that they have shoes. So we want to say something out loud. I see you have shoes on. We're going to stand at an oblique angle, grab the gait belt around the sides or back, and count to 3 when we lift. We're going to ask if they're dizzy, and then we're going to let them lead. We want to walk slightly behind and to one side and make sure that you're holding that gait belt underneath in an underhand grip at the small of their back. We want to monitor how they feel throughout the skill. Ask, how do you feel? We'll use the gait belt to control the descent. So we're going to sit them the same way we stood them, same stance. You can see how my feet are positioned in front and to the side. And we don't want to pull the gait belt across the body when we remove it. We want to make sure at the end the patient is seated properly. Okay. Well, let's talk a little bit about energy conservation. So this is going to be on page 63. Anybody ever see an older person try to get up out of a chair? Call it the rock and roll method. They start doing this. They start to rock. They need momentum. And when they get enough momentum, they'll roll their way up. Nope. Right back down. And then they'll rock a little bit more. How much energy did that take? Oh, it did. It took a lot. It took way more energy than if I just simply stood up. That didn't take much energy at all. Now, unfortunately, you guys are all young with strong muscles, so you simply just stand up out of a chair. It doesn't really dawn on you how much energy standing takes because you got lots of energy. And that's because energy and effort are two sides of a seesaw. When you have a lot of strength, okay, it takes less effort to do something. When you have less strength, it takes more effort. Make sense? So our patients usually are lacking in strength. So what does that mean for their effort? More effort. That's where we come in. Because if we can use some of our strength to offset their effort, they get to conserve energy. Now, why do we care? So a lot of people think older people have nothing to do and all day to do it. So it really doesn't matter how much effort they expend because who cares? But it actually is a little more important than that. In order to understand this, we have to go all the way back to 2-year-olds. Super cute little guys. I love 2-year-olds. Tons of energy. Inquisitive about the whole world. 2-year-olds will jump up and down for no reason. They don't have to have a reason to jump up and down. They just do because they got lots of energy. You ever see a 2-year-old? Okay. Have you ever tried to explain to a 2-year-old why you do not have the same energy they do? Do they ever get it? No, they don't get it. They think, because that's their whole experience, right? I have energy. I have never experienced anything else. So you must have the same energy I do. They don't get it. And they won't get it until they get to be your age. They have to have experience with it to truly get it. Good? Makes sense? Okay. So 2-year-olds will jump up and down for no reason. But energy levels peak in that time frame. It's all downhill from there. Let's go out to 12. 12-year-olds, still tons of energy. They skateboard and play basketball and play games with their friends and gossip on the phone for hours, right? They have tons of energy. But you put that 12-year-old in charge of that 2-year-old for one afternoon, who wins? 2-year-old, every time. Every time. So that tells us our energy levels have declined in that 10 years. Now let's go out to 22. Now 22-year-olds can shop till they drop and go out at night looking fabulous, party all night. But you do not have the same energy levels that you had when you were 12. Let's go out to 42. 42-year-olds shop till they drop, but hey, it's going to be at like 3 and we're not going out tonight. Okay. Our energy has further declined. 62-year-olds. Now we're talking about putting our feet up for 10 minutes before we make dinner. We're contemplating retirement because there's just not enough energy to keep up with daily household activities as well as work. So we're starting to slow down a little more. It's becoming more obvious because our energy levels have further declined. Now, what do you think it's going to be like at 82?
You're not going to have no energy.
Right. Do you see how energy levels decline throughout your lifespan? That's where we come in. That's why we have to know how to do all the ADLs, how to help our patients stand, how to turn them over in bed, because they may simply not have the energy that they need to take these routine tasks that we take for granted. They may not have the energy to perform them. That's where we come in. Make sense? You guys understand that? Okay. So, old people have nothing to do and all day to do it. Why do we care how much energy they have? Well, in order to understand this, we have to think about the things we do every day that take energy beyond ADLs. We know brushing teeth takes energy. We know getting dressed takes energy. We know walking somewhere or getting up out of a chair takes energy. These are things that we can readily see. But there are some things that we do that take energy that you probably aren't aware of. And the real way to find this out is, have you ever been too tired to blank? Okay. Have you ever been too tired to eat? Anybody ever been too tired to eat? That tells you eating takes energy. So if we have an older individual that doesn't have the energy to eat and isn't taking in nutrition, what do you think is going to happen to tomorrow's energy levels? Yeah, they further decline. Have you ever been too tired to bathe? That tells you bathing takes energy, right? Now, CNAs get this one all wrong all the time because CNAs think, well, I'm the one bathing them. All they're doing is sitting there. I'm doing all the work. Why won't they let me bathe them? They say they don't have the energy for bathing, but I'm doing all the work. And they try to force the patient into the shower. Understand that just sitting there also takes energy. Having somebody undress you takes energy. Just sitting up takes energy. So we need to understand that when our patient says, I don't have the energy for that, we need to believe them. They truly sometimes don't. But other things take energy too. Have you ever been too tired to talk? Anybody ever been too tired to talk? On Mondays, when I'm done teaching, I am too tired to talk because I talk for 4 hours straight. When I go home, I just need a couple of hours of no talking. Thankfully, my husband understands this. But being too tired to talk is actually a thing. So if we are social creatures and we rely on socialization for pretty much everything, and our patients are too tired to talk, that can lead to depression, withdrawal, unengagement. It can also lead to anxiety because the things you need to talk out, you don't have the energy to do that. You can't process things. Could that be a problem for our patients? Do you think they have anything to process? You know, the fact that they're not in their home, that they don't have their possessions, that their family isn't visiting, that the staff that's taking care of them don't seem to care. Those are all real stressors for our patients. And if they spent all of that energy just getting up out of a chair and there's none left to have conversations, that resentment can build up. And then we get acting out. Does that sound familiar at all? Okay. Make sense? Good. So energy conservation in the elderly is way more important than you realize. It's going to affect their nutrition. It's going to affect their daily habits. It's going to affect their mental status. It's going to affect their ability to process emotions and things that are happening. So everything that we can do to help our patients conserve energy contributes to their physical and emotional well-being moving forward. Because the real problem here is it's super easy for the elderly to get in a downward spiral that ultimately takes their life. And we can help prevent that by doing something as simple as using a gait belt to help them stand. That helps them conserve energy. Because think about how much energy this takes. Now think about how many times that person has to get up and down out of the chair. We talked about toileting having to increase as we age. Remember we talked about that with chapter 4, right? Incomplete bladder emptying, decreased volume in the bladder. So they've got to go to the bathroom way more often, probably about once an hour. That's up and down off of the chair in the toilet. They have to eat meals. They have to get up and down off of the chair. They get in and out of bed. That's up and down. They go to activities. That's up and down. That's a lot of energy. And when you only have this much energy for the entire day, because our energy levels have dropped, at the end of the day, we probably don't have enough to eat dinner. is probably not even there. Okay. If we can help offset that energy expenditure, then at the end of the day, they have energy to eat dinner, and tomorrow's energy levels are better. What we do matters. Okay. Good. All right. So let me get somebody to come sit down in this chair, and I will show you this skill. All you got to do is walk 10 steps. Thank you. All right. Here we go. Hi, Miss Jones. My name is Patti. I'm your CNA today. How are you? Great. You feel like going for a little walk? Okay, let me go close your curtain real quick. I'm going to wash my hands, get my supplies, and I'll be right back. I notice this is in my way. I'm going to move it out of my way before I wash my hands. I have clean hands. I'm sorry. Back up, back up. Correction. I'm going to pull a curtain. I have clean hands. All right. Okay, I see you have shoes on. That's good. Are your feet flat on the floor? Good. I'm going to put this gait belt around your waist. This is going to help me lift you to a standing position and provide a little stability, okay? I'm just going to slide this around your waist. We're going to put it through the first guard by the alligator teeth, and we're going to pull it so that it's snug, and I can only fit 4 fingers. Put it through the second guard. And tuck that loop out of the way. Can you bring your feet together for me? Thank you. All right, you're going to put your hands on my shoulders, and on the count of 3, I'm going to help you stand, and then we'll stand for a second to make sure you're not dizzy, okay? So 1 foot in front, 1 foot parallel. Go ahead and put your hands up here. And on the count of 3, 1, 2, 3. Good. Dizzy at all? Okay, we're going to walk to the second table. You're going to lead at your pace. Feeling okay?
Yes.
Okay, we'll go ahead and turn around, and we'll walk back to the chair. Still feeling all right? Okay, when you get to the chair, turn around and back up so the backs of your knees hit the chair. Can you feel it?
Mm-hmm.
You're going to put your hands up here, and we're going to do the same thing to sit on my shoulders. There we go. 1, 2, 3. Very good. So I'll remove the gait belt. I'm going to loop it up over. There we go. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Okay, environment is clean. Call light is there. We're going to pretend that you can reach it. Okay. I'm going to go open the curtain. Put my gait belt away. Wash my hands. My hands are clean. Tell the evaluator my skill is done. Thank you. Questions? They gave you 5 minutes to do all that. It took me maybe 2. Lots of time. Don't rush. All right. Questions? No? All right. The big skill. Go to page 126. All right, if you look at page 126, you will see hold on one second. Linens in the trunk. Yeah, thank you. Okay, if you look at page 126, you will see all the principles involved in this skill. And there's a lot. We're going to follow the care plan. We're going to do our opening. We're going to use gloves for this skill because we're around wet body openings, the ones on the face. We're going to use a barrier for our supplies. Our patient's uncovered and undressed for this skill, so we need a privacy blanket. Linen rules are going to apply. Remember, linen rules, we don't want to hold anything against our uniform. Nothing touches the floor. all of those rules. Our patient must always be in the middle of the bed, and we're going to have to clean their back. So that means we're going to turn them. So we're going to scoot them toward us first. It's a washing skill, so all the washing rules apply. We have a basin that we're cleaning. Can you pass out a washcloth to each student, please? We're going to clean the basin. We have some skill-specific steps we're about to learn, and we're going to do the closing. This is the longest skill that we have. If you look at the time at the bottom of the page, you'll see that it should take somebody with your level of experience 19 minutes or less to do this. That's a long skill, guys. Considering the one we just learned is 5 minutes, right? It's a long skill. All right. Not a whole lot to learn, though. So for this skill, if we look at the care plan on page 127, it tells us to give the resident a partial bed bath and a back rub. Let's stop there for a second. Time out. We are not massage therapists. We are not deep tissuing anything. This is not a hot stone type situation. This is literally for circulation and to make the patient feel just a little better. When you were little, did mom ever come along and rub your back when you were sick? It always made you feel just a little bit better, cared about as well as cared for, right? This is what we're doing. So when it talks about a back rub, it's just starting at the small of the back, going up to the shoulders in small circles 3 times. That's it. That's the whole back rub. So don't get all caught up in the back rub thing. It tells us specifically, because it's a partial bed bath, it's got to tell us what to wash. Otherwise, it would be a whole bed bath and you're going to wash the whole body, but we're not doing that for this. It only wants us to wash some parts. So it's got to tell us what parts. So this care plan tells us to wash the resident's face, neck, chest, abdomen, back, and one arm and hand. Kind of like hand care and foot care. Remember, it only said one. We get to pick which one. In a clinical setting, if we're only washing one, it's going to tell us which one. Okay. We're going to wash all those areas with soap and water. Provide a brief back rub with lotion and dress the resident in a clean hospital gown after bathing. Patient is lying on back in center of bed and can roll as directed, but is too weak to assist with bathing. So it's a long care plan. It's very detailed on purpose. So we have to make sure we're following that care plan. Now, supplies for this one are at the bottom of the page. You'll see all of the supplies. There are a lot of supplies for this, but try to make it make sense. It's a washing skill, so we automatically need a basin and soap. We need washcloths and towel. Now, there are 2 towels, sorry. There is a way to remember washcloths that's super easy for the test. If you're washing a small body part, one hand or one foot, you need 2 washcloths. One to wash, one to rinse. Everything else for the test takes 4. Okay, good. All right, it tells us to dress them in a clean hospital gown. So we'll get that. Told us to provide a back rub with lotion. So we need lotion. And we know we're working around wet body opening. So we need gloves. So try to make it make sense. Okay, good. Got to memorize it. Shorthand version to remember this skill is this right here. Partial bed bath, face to waist, front and back. Tells you everything you needed to know. Face to waist, front and back. And care plan says just one arm and hand. Easy peasy. All right, so this is a washing skill. So let's review the washing rules one more time. Basins are no soap zones. We don't put soap in the water because we need water for rinsing. We're going to use a paper towel to turn that faucet on, and we're going to check the water. What temperature should it be? Warm. Who else checks the water? Yeah, but if you look, this is going to be done on a mannequin. So you're going to ask the mannequin, can you check the water? And the mannequin's going to say, it's fine, thank you. because the voice of the mannequin is played by the evaluator. You'll actually get an answer. Okay. We're going to use the leaves method, which I'm about to teach you. Whatever we wash, whatever we rinse, we dry, and we're not going to get the surface wet. In this case, it's the bed. So I need to put something underneath the patient. You can use the chucks, but chucks are plastic lined. They're going to hold in body heat, can make the patient sweat. It's not always comfortable. So I prefer to use a towel. Much better for bathing. Okay. You can use either. And because we're providing a back rub with lotion, we're going to warm the lotion up. And then what do we do after we put it on? Wipe off the excess. So good? We know all the washing rules. Oh, yeah. Hold on. I go through all the washing rules here with you. Okay. So this is where I'm trying to get to. This is the one rule we haven't learned yet, and that's the leaves method. So we have a washcloth in front of us. Everybody has a washcloth. It's a square washcloth. You probably have some of these at home in your linen closet somewhere. And we usually fold them in half and then in half again, so it makes a little square. So everybody make a little square. Fold it in half and in half again. Didn't know you were going to learn how to fold laundry today, did you? And we're familiar with these, right? They're in a laundry closet somewhere. But instead of looking at it as a square, which is what we usually look at it as, we're going to turn it a quarter turn and look at it as a diamond. And we want to position it with all the free corners at the top. So you should have a diamond with the free corners at the top. If you put that in the palm of your hand and you tuck one corner in between your pinky and your ring finger, and you tuck the other corner between your thumb and index finger, you now have something that looks kind of like a mitt. This is called the leaves method. And we use this anytime we're washing a wet body opening. So a wet body opening would be eyes, nose, mouth, genitals, rectal area, rashes, wounds, sores, or incisions, any skin that isn't intact. And the reason is it helps prevent cross-contamination. We can wipe something with this leaf and then fold it over, and that traps the contamination underneath. We can wipe something else with this leaf and fold it over, and that traps the contamination underneath. We can wipe something else with this leaf and fold it over, trapping the contamination underneath. We can use this leaf and fold it over, and we can use the backside. So we have 5 independent cleaning surfaces without cross-contamination. We're going to use the leaves method anytime we're washing any of these. The eyes. So I'm going to take my washcloth and wipe inner to outer corner on one eye, fold that over, inner to outer corner on the other eye with the second leaf, fold that over. The third leaf, I can wash the rest of the face and the mouth, fold that over, and I always do the nose last because boogers, and then wipe the nose. So I did that in a way that nothing that came out of one hole can be put into another. Good? Pretty cool, right? If you have small children at home, that will save you a tremendous amount of laundry and disposable wipes. All right, so this is a visual representation of that. So the first leaf, we wipe something and fold it over. The second leaf, we wipe something and fold it over. That gives us a third leaf to wipe and fold over. The fourth leaf, we can wipe something and fold that over, and we can even use the back side of the washcloth. So you now know everything you need to know to do a partial bed bath. The principles never change. Our patients uncovered or undressed, so what are we going to put on them? Privacy blanket. Yeah. So there's nothing new here to learn. We're just going to take all the principles that we've learned so far and put them into a new skill. Okay. The only thing that you needed to learn that was new was the leaves method. Okay, good. Not too bad, right? Not too bad. So to go through this, because it is a long skill, remember 19 minutes. Doesn't take me 19 minutes to do this, but you've got 19 minutes if you need it. Let's go through these steps really quickly. We're going to place our clean supplies on a barrier on a table. We're going to fill the basin. Remember, use a paper towel to get our water. We'll check it. We're going to have the patient check it. We're going to protect the sheets with a towel. We're going to use a privacy blanket. We're going to wear gloves because we're going to be cleaning wet body openings. Remember, if we're wearing gloves, first thing our gloves should touch is the patient. We're going to wring our washcloths out thoroughly. Remember, no drippy wet washcloths anywhere. We don't want to use soap on the eyes because it stings the eyes. So just water on the face. We're going to use the leaves method for our wet body openings. So we're going to start at the first eye, inner to outer corner, and then we'll fold that leaf over and wipe the other eye, inner to outer corner, fold that leaf over, and then wipe the rest of the face and fold that leaf over, and then the nose last. We'll set that washcloth aside. We don't want to put it back in the basin, and we're going to dry all of those areas. Whatever we wash, we rinse. Whatever we rinse, we dry. And then we're going to move on to the torso. So I'll start under the chin and just wash everything down to the waist, up the side, down the arm. I want to do the armpit last because ew, right? Armpit last. So whatever we wash, we rinse. Whatever we rinse, we dry. Always supporting the extremity from below. That's not new. We've learned that. And we'll change the gown. Once we get the front clean, wash, rinse, dried, let's change that gown. That way, when we turn our patient over to clean the back, the gown is already on. We've got them on their side. We wash, rinse, dry the back, give a little back rub, and then we're going to tie that gown. So we don't have to flip them back, put a gown on, flip them over to tie the gown, flip them back. Remember, little bits of extra time add up. We want to try economy of motion. All right, we'll turn our patient onto their side, wash, rinse, dry the back, give a brief back rub with lotion, wipe off the lotion after we apply it, tie their gown, return them back to the center of the bed, and then do our closing. Okay. Any questions on that? I'm going to show you this video because it has good close-ups of everything. And then we're going to do respirations, which is the skill we didn't get to last week. So we'll get into respirations after this, and then the rest of the class will be practice. Okay, good. All right, go ahead. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves. Miss Jones, let me go get some water. I'll be right back. Miss Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown. And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Miss Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Miss Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this leaf over to prevent contamination from spreading to the other eye. Miss Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso, around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinse washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. Go ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Ms. Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Ms. Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, and we'll soap the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out, and we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please, and scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin, and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded, and now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done. All right. Any questions on partial bed bath? No? There's really not much new to learn with partial bed bath. It's just repurposing the steps that we learned before. All right, so we're going to move on to respirations, which is the skill we didn't get to last week. And that's going to be on page 54. I don't have any slides for this because we're adding it in. So page 54. Respirations looks a whole lot like pulse. Your patient is laying in the bed. It's a real patient. It looks just like taking a pulse. In fact, we're actually going to hold the patient's wrist like we're taking their pulse, because if you don't, they're going to know what you're doing. They're going to know you're counting their respirations. So for this skill, we actually don't tell them we're counting respirations. We say we're taking your vital signs. Because if the patient knows that you're counting their breathing, it alters their breathing. So if you tell them I'm counting your breathing, ready, set, go, they'll either hold their breath or they start breathing fast because they're anxious. So we don't want to tell somebody that we're counting their breathing. We also don't want to just stand over them and stare at them because that's just creepy. So we're going to hold their wrist so that they think we're taking their pulse, but we're not. We're just counting their respirations. Okay, good. At the top of the next page, you see the care plan, and the care plan tells us to count the patient's respirations for 1 full minute and record our readings. So normal values for respirations are between 12 and 20. That's what normal is. If we get less than 12, what do we do? If we get more than 20, what do we do? Tell the nurse. So in and out counts as one. It doesn't matter where you start on the cycle. It's one cycle. So if you start counting on an inhale, you count it. If you start counting on the hold between the inhale and exhale, you count it. If you start counting when they're exhaling, you count it, because the whole thing counts as one. Okay, so okay, in and out counts as one. For this skill, our care plan tells us to count for 1 whole minute. So how long are we counting for? 1 whole minute. There's not much here, right? It's kind of an easy skill. Patient's laying in bed. You're not going to tell them you're counting their respirations. You're going to count for 1 full minute. We're going to look at the clock, say start when we start counting, say stop when we stop counting. So the evaluators start and stop when we do. And then we're going to do our closing, wash our hands, document, and wash our hands again. So not a whole lot to learn for this skill. It's actually a pretty easy skill. But there is a legal way to cheat for this skill. Isn't that cool? So we are going to document. This is my documentation form. And you can find this in your skills book, toward the back of the skills book in the appendix. I have documentation forms for you guys to play with. And we're going to record where it says record respiration. So you have a sample on that page for respirations that you can look at. Hold on, guys. Let me just clean up a little bit. Okay. All right. So I need a volunteer here to come lay down in bed. All you got to do is lay there. You don't have to do anything for this skill but lay there. Notice she put herself in the middle of the bed. It's like you guys do that all the time without even thinking about it, right? Remember, your patients will do that too. Okay. All right. So this skill, I'm going to count her respirations. Now, if you're over there, and the best way, I'm just going to adjust your top a little bit. Okay. All right. So the best way to count respirations when somebody is laying down is to look at their tummy going up and down. So just breathe. You're fine. Go take a nap. You're good. You're good. So you'll actually see her tummy move up and down as she's breathing right now. Right now, she's a little nervous, so it's going to alter her breathing. But you'll see her tummy move up and down. It's hard to see. But if you zone in on it, you can kind of pick it up. Now, the way that we can do this to make it easier to see is simply by putting an alcohol pad on her tummy. Now you should be able to pick her breathing up a whole lot easier. Can you see it? Now, I didn't alter her breathing at all. What I altered was your ability to see it. I use psychology. That's all this is your attention is drawn to movement when it's a contrasting color. That's a psychological principle. So by putting an alcohol pad on her tummy, it's a contrasting color, which will make seeing the respirations a whole lot easier. Make sense? You're allowed to use this on the state exam. You're also allowed to use it in a clinical setting too, because it does make respirations easier to see. Now, for the test, the reason they have the patient laying in bed is because laying down, it's easier to see respirations. Sitting up, you have to look at the chest and the shoulders rise and fall, and it's harder to pick up. It's easier to count respirations when somebody is laying down. So for the test, remember this is entry-level skills examination. So they set every skill up to be the easiest possible version of that skill. So that's why your patient is laying down. Okay, so just stay there for me. All right, so we're going to do this skill together. I'm going to do my opening. I'll put an alcohol pad on her tummy. I'll look at the clock and pick a starting point and say start. And you are going to count the respirations that you see. Remember, in and out counts as one. You're going to count the respirations that you see. And when I say stop, you can write it down somewhere so you remember it. And I'm going to do my closing, wash my hands and document, and then wash my hands again. And we'll see how close we get. Okay? So you guys are all playing the evaluator for the next couple of minutes. So here we go. Hi, Miss Jones. My name is Patti. I'm your CNA today. How are you? Good. I need to take your vital signs. Is that okay? I'm going to close your curtain. Let me go wash my hands and I'll be right back. Oops. I have clean hands. Okay. Just going to lay that there for just a second, okay? Let me see your wrist. Can everybody see? You can come over here if you want. Can everybody see? All right, ready, set, start. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Okay, here's your call light. If you need anything at all, just press that red button. I'm going to open the curtain. I'm going to go wash my hands. After washing my hands, I will document on the documentation sheet that they've given me, and I will wash my hands again. After that, I'm going to tell the evaluator my skill is done. Thank you. What'd you guys get?
12.
Okay, 11 or 12, either one would be appropriate. So I got 11. Good. You can be off by 2 breaths in either direction and still be accurate. So if the evaluator got 11 and you got 9, 10, 11, 12, or 13, you are accurate. Okay.
So when we count it, right? So let's say you start, but they're like breathing out. That counts, right?
Right, because in and out is one whole cycle. So it doesn't matter where you're counting in that cycle, it counts. Okay. So what is normal? Do you guys remember what I told you normal was? Yeah, and we got I got 11. So what would I do with that? Report it to the nurse. Absolutely. She was just really chill, so I'm not really worried. All right. So any questions on respirations? It's a quick skill to learn. Respirations is a documentation skill. If you remember, I told you you will get 1 documentation skill for the state exam. You guys remember that? Pulse, respirations, feeding, which we're going to learn on Wednesday, or emptying a drainage bag, which we're going to learn on Monday, next Monday. You will get 1 of those 4. Out of those 4, respirations shows up more on the test. It is the most common documentation skill. You see it on more care plan sets. Okay, so it's probably one you want to practice. The good news is if you have a live anything at home, human, pet, whatever, you can watch and count respirations to get practice. Okay. So that is it for today. You have an entire hour of practice available to you. I'm going to print off your review sheets for today so that you have them. If anybody needs any makeup sheets, let me know. You know, if you missed one and you need them, let me know. And I know I'm going to help you. Okay. Okay. So just let me know and I'll get you the one that you need. Does anybody have any other questions before I end class today? So for those of you in YouTube world, hold on. Let's go back over here. All right. So for those of you watching us online, I always end the sessions during practice. There's no need for you to see the students practice, and plus it makes them nervous. I want them to practice. So we do sign off during practice time, but please make sure that you're practicing somewhere. You need to be practicing these skills. Don't let the test be the first time you do a skill because you're not going to get it right the first time. You're going to be all over the place. There's going to be mistakes like crazy because you're learning, and that's appropriate. This is when you're supposed to make the mistakes. Don't let the test be the first time you do a skill because that counts. So make sure you're practicing. If you're joining us virtually and you're not in my class to practice, consider buying a practice kit that has everything you need in it to practice. So the Gait belt, the basin, the dentures, the denture brush, the toothette, the bedpan, everything you need to practice, chucks, gloves, all of it is in the practice kit. It comes in a carrying case, and I don't have one in here to show you. I'll bring one on Wednesday. But go to my website and order one if you're not physically here to practice. Everybody that's physically here, you have all of the supplies here. But if you're not staying to practice and you don't practice in class, you might want to consider getting a practice kit if you're going to be practicing at home. That way you learn how to use the gait belt and the drainage bag and all of the other things that we use for the test. Okay? All right. So until next time, I will see you tomorrow for the game show at 11 a.m. Don't forget, And we'll see you on Wednesday for class. Only 3 classes left, guys. That's it. 3 classes. So we're going to sign off now so they can practice. Until next time, happy caregiving. Bye. Can you please end?